had South Texas Sinus Institute on the show before to kind of talk about balloon sinuplasty and exactly what it does. But, well, now we want to get a little farther in, really find out, of course, why someone would need to get balloon sinuplasty, and, of course, bring along a patient as well to kind of talk about their experiences with some of the allergy issues that they've been having. Here to tell me all about that is Liliana Rodriguez, medical assistant, and one of the patients that they have there at South Texas Sinus Institute, Aaron Perez. Good morning.
Good morning.
Thank you very much for being here, guys.
Likewise.
So, Liliana, I'm going to start with you just a little bit. Obviously, you know, we've talked about balloon sinuplasty and how much it can really help people, but I want to know, what are some of the reasonings behind people at home behind getting or needing to get balloon sinuplasty?
Yeah, the balloon sinuplasty procedure is minimally invasive and it's safe. And symptoms are congestion, sinus pressure, headaches, snoring, and a little bit of tension. You know, your life is like stuck because you can't proceed further because you're always in pain and you're always constantly just fatigue.
Mm-hmm. Now, how do we know if we're a good candidate? Because obviously, you know, on a normal basis, we might have some of these symptoms, but how do we know that this is the right path for us?
Yeah, because many times, many patients get misdiagnosed with other doctors, so they just keep on giving them antibiotics, allergy medication, you know, the treatment fails. So the best thing for them to do is to give us a call at South Texas Sinus Institute and make an appointment.
Of course. So, and one of the patients that actually did just that was Aaron. Aaron, thank you so much for coming in. I mean, obviously, before you got the procedure done, you must have had a lot of the symptoms that they were talking about. How did you know you were having all of these, like, problems, these issues with your sinus?
Just, sorry.
No, that's fine.
I couldn't breathe. I had trouble sleeping, snoring, frustration. Having a lot of napkins in my pocket. It got to a point it was just embarrassing, and so I went ahead and took that step.
And it must have been a scary step to take, obviously, to reach out, because I mean, as humans, we're kind of scared to ask for help, you know.
Of course.
So it must have been a little scary to make that first phone call, right?
Yes, it was. But it was the best decision that I have made. So.
Of course. So obviously, you know, when you decided to actually do it, I mean, what was the tipping point? When did you decide, you know what, it just has to be done? Something has to be done about this.
When it started affecting my work, having to take breaks constant, and just seeing my boss being upset, you know, it was affecting my work, and of course, that's very important.
Of course. So now that you've actually had the procedure done, I mean, how has it been? Is it like a night and day, essentially?
It's been great. I could breathe now. I sleep better. My frustration is gone. And just all around, it's good.
That's good. And obviously, when you went in, they took care of you every step of the way, right?
Yes, of course, they did.
Awesome. So, Liliana, if people at home right now are watching and they're thinking, you know what, I want to be like Aaron, I want to have this procedure done, how do they get in contact with you guys?
They can call us at 956-661-8200, or they can always, you know, search us on the web, southtexassinusinstitute.com.
Awesome. So if you need any more help with any of this, if you had any issues like Aaron did and definitely need help, go ahead and reach out to them, and they'll be able to help you out at the South Texas Sinus Institute. Guys, thank you so much for coming by. I really appreciate it.
Thank you.
All right, we're going to go and take a quick 2-minute break, but there's still so much more ahead right here on Good Day Valley.